Don't ignore if you feel chest discomfort lasting more than a few minutes, pain radiating to neck, jaw, back, or arms, nausea, cold sweat, or lightheadedness, animated diagram of clogged arteries. Interview-style doctor advice. Time is muscle. The longer you wait, the more heart tissue dies. What to do immediately? Call emergency services. Do not drive yourself. Take an aspirin if advised by your doctor beforehand. Sit down, stay calm, and wait for help. Every second counts. Acting fast can mean the difference between life and death. Closing line for point 1. Chest pain is not just pain, it's a message. If your heart is trying to speak, don't silence it. Listen and live. Point 2. Sudden or frequent shortness of breath. You're just walking to the kitchen or taking a short stroll outside. Suddenly, your breath gets shorter, your chest tightens, and you need to sit down. You feel like you just ran a marathon, but you didn't. This isn't just aging. This is a symptom doctors take very seriously because it's often the first sign of something deadly. Shortness of breath, especially if it's new or worsening, can signal heart failure, a blood clot in the lungs, or even lung cancer. What's happening in your body? Your lungs may not be getting enough oxygen. Your heart may not be pumping efficiently. Or your blood vessels could be blocked or damaged. Animation of lungs struggling to expand, heart pumping slowly with backflow. Elderly person walking then pausing, gasping gently. Red flag patterns to watch. Breathing difficulty even at rest, needing pillows to sleep upright. Wheezing, coughing, or chest tightness during mild activity. Sudden breathlessness that feels like panic. Sometimes this symptom hides behind fatigue. If you're constantly exhausted but can't explain why, don't assume. Get checked. Common causes after 60. Congestive heart failure (CHF). The heart becomes too weak to circulate blood properly. Pulmonary embolism (PE). A clot in your lungs, often sudden and dangerous. Chronic obstructive pulmonary disease (COPD). Smoking-related or pollution-related lung damage. Anemia or low blood oxygen can cause breathlessness even without lung issues. What to do? If it's sudden or extreme, call emergency services immediately. If it's recurring or mild, but worsening, see your doctor for a full respiratory and cardiac checkup. Do not self-diagnose with asthma or anxiety. It could be much more. Doctor using a stethoscope, running tests, CT scan visuals of lungs and heart. Closing line for point 2. Breathing is something we take for granted until it's gone. If your breath feels stolen, don't waste time. Your body is asking for help. Answer it with action. Point 3. Sudden confusion or memory loss. Imagine waking up one day and not recognizing where you are. Or forgetting the names of loved ones, losing your train of thought mid-sentence, or getting lost on a familiar street. These aren't just senior moments. Doctors warn that sudden confusion, disorientation, or noticeable memory loss after 60 could signal something dangerous. Even life-threatening. What's really going on? Your brain relies on a steady supply of oxygen and nutrients. If that supply is interrupted by poor circulation, inflammation, or disease, your mental function suffers quickly. This symptom can be the first sign of stroke, brain infection, or even dementia onset. Visual suggestions. Elderly person staring blankly, struggling to find words. Split screen, healthy brain versus brain with plaques, Alzheimer's. Family members looking concerned during a conversation. Warning signs to watch. Sudden difficulty speaking or forming sentences. Getting easily confused with time, place, or people. Misplacing things often and being unable to retrace steps. Trouble understanding visual or spatial relationships. Poor judgment or irrational behavior out of character. Potential causes. Stroke or transient ischemic attack (TIA). A clot blocks blood flow to the brain. Early Alzheimer's or other dementias progressively impacts memory and thinking. Urinary tract infections (UTIs) in elderly often cause confusion without fever. Medication side effects. Some drugs affect cognitive clarity. Dehydration or low sodium levels can cause mental fog and delirium quickly. Hospital monitor showing brain scan. Elderly woman looking at photo album, slowly forgetting names. Doctor gently explaining diagnosis to family. What to do? If confusion happens suddenly and severely, Call emergency help immediately, could be stroke. Keep a diary of memory issues to track patterns. Schedule a full cognitive evaluation with a neurologist. Keep hydrated, manage blood pressure, and review all medications regularly. Closing line for point 3. The mind is a beautiful library. When pages go missing or get jumbled, don't wait. Seek help early because sometimes the book can still be restored. Point 4. Unexplained weight loss. Many people in their 60s or 70s may feel pleased when they lose a few pounds. But if you haven't changed your diet, haven't started exercising, and yet the weight just keeps falling off, that's not a good sign. In fact, doctors warn that unexplained weight loss after 60 can be a red flag for serious illness, sometimes even cancer. Why it's so dangerous? Your body maintains a careful balance. When weight drops suddenly without reason, it often means something is working against your health. It could be a metabolic disease, a hidden cancer, a digestive issue, or a hormone imbalance. Worse, seniors often lose muscle first, not just fat, which weakens the body and increases fall risk. Elderly person checking weight on scale, looking confused. Side-by-side image showing frail versus healthy senior body. Graph showing gradual versus sudden weight drop. Watch for these signs. You lose 5% or more of your body weight in 6 to 12 months without trying. Your clothes suddenly feel looser. You're eating normally but still dropping pounds. You feel tired, weak, or dizzy. You notice muscle loss or sunken cheeks. It's not just about numbers on the scale. It's about energy, strength, and internal health. What could be causing it? Cancer, especially colon, stomach, pancreas, or lung cancers. Thyroid overactivity, hyperthyroidism, speeds up metabolism abnormally. Malabsorption issues, like celiac disease or chronic pancreatitis, food isn't absorbed properly. Depression or anxiety, appetite suppression is common but often overlooked. Diabetes, if unmanaged, can burn fat and muscle rapidly. Heart failure or kidney disease often comes with fatigue and appetite loss. Animated gut showing poor nutrient absorption. Visual of a thyroid gland overproducing hormones. Doctor reviewing a patient's weight history on a tablet. What you should do if you're losing weight without trying: see your doctor immediately. Ask for full blood work, thyroid tests, digestive screenings, and cancer markers. Track your weight weekly and note any fatigue or appetite changes. Do not brush it off as just age. Your body is trying to tell you something important. Closing line for point 4. Your body is your best messenger. When it shrinks without cause, take that message seriously. Because catching the problem early might just save your life. Point 5. Chest pain or pressure. It starts with a tightness, a pressure. Maybe a dull ache in your chest, or a squeezing in your upper body that comes and goes. Most people over 60 try to dismiss it as gas, muscle strain, or stress. But doctors urgently warn chest pain or discomfort after 60 must never be ignored. Because it could be your heart warning you of an imminent attack. Why this is a top killer. Heart disease remains the #1 cause of death worldwide, especially in people over 60. The pain isn't always sharp, it's often dull, spreading to the arm, neck, back, or jaw. Some seniors, especially women, may not feel pain at all, just nausea, fatigue, or shortness of breath. Elderly man clutching chest, sitting on couch. Heart animation showing a blocked artery. Timeline of a heart attack building over hours or days. Symptoms you shouldn't ignore. Pressure, fullness, or tightness in the center of the chest. Pain radiating to shoulders, arms, neck, or jaw. Shortness of breath even at rest. Cold sweats, dizziness, nausea, fatigue, or feeling of impending doom. These symptoms may come on slowly or hit suddenly like a thunderbolt. But both are equally dangerous. Possible underlying causes. Angina, chest pain due to narrowed arteries and low oxygen to the heart. Heart attack, myocardial infarction, a complete blockage cutting off blood flow. Pericarditis, inflammation of the sac surrounding the heart. Pulmonary embolism, a clot in the lungs causing chest discomfort and breathing difficulty. Aortic dissection, a tear in the aorta, often fatal if not treated immediately. Doctor performing ECG on senior patient, 3D animation of heart showing clot build-up. Elderly woman lying in ambulance as paramedics work urgently. Point 6. Sudden changes in vision or speech. Imagine you're reading a newspaper and suddenly the words become blurry. Or you're talking to a friend and your tongue feels heavy, your words come out jumbled or slurred. These moments are terrifying, and they should be, because doctors warn that sudden changes in vision or speech can be signs of a stroke. And in people over 60, strokes are one of the leading causes of death and long-term disability. Why this is an emergency? A stroke occurs when blood flow to part of the brain is blocked or interrupted. Brain cells begin dying within minutes, every second counts. Seniors are at far greater risk due to age, blood pressure, cholesterol, and history of heart disease. Animation showing a blood clot in the brain. A split screen, normal brain activity versus stroke-affected brain. Elderly man looking in mirror, one side of face drooping slightly. Warning signs to watch for. Use the FAST acronym, FE face drooping. Ask the person to smile. Does one side droop? A arm weakness. Ask them to raise both arms. Is one weak or drifting down? SS speech difficulty. Ask them to repeat a simple sentence. Is it slurred or strange? Time to call emergency help immediately. Also watch for blurred or double vision, sudden confusion or memory loss, loss of balance or coordination. Severe headache with no known cause. Even if symptoms vanish after a few minutes, it may have been a mini-stroke. TIA. A powerful warning that a full stroke is likely to follow. Common causes in seniors. Ischemic stroke, caused by blood clot, most common. Hemorrhagic stroke, caused by bleeding in the brain. Transient ischemic attack. TIA. Temporary blockage that resolves but signals danger. Atrial fibrillation, AFib. Irregular heartbeat that increases stroke risk. High blood pressure, a silent killer that damages blood vessels over time. Animated arteries narrowing from cholesterol buildup. Senior in hospital getting a CT scan. Medical monitor showing a regular heartbeat. Immediate steps to take. Call emergency services. Do not wait or try to sleep it off. Stay with the person and keep them still. Note the time symptoms began. This is crucial for doctors to administer stroke reversal medication. If it's you experiencing symptoms, don't hesitate, seek help right away. Time lost is brain lost. Delaying care could mean a lifetime of paralysis, speech loss, or even death. In your 60s and beyond, every sudden change in your body is a message. Especially when it affects how you see or speak. Don't wait, don't guess. Act fast, because your brain, your voice, and your life depend on it.